The number of new coronavirus cases has surged by more than 7,000 in the UK for the second day running. Another 7,108 infections were recorded in the past 24 hours, the second highest daily total since the pandemic began. And another 71 deaths were reported for the second successive day, taking the tragic death toll to 42,143. England's confirmed cases rose by 5,656, Scotland 640, Wales 388, and Northern Ireland 424, taking the overall number across Britain to 453,264. Today's number of new infections is slightly down from yesterday's 7,143. Which was the highest ever daily increase since the coronavirus pandemic began. Last Wednesday, another 6,178 new cases were reported in Britain, one of the highest daily totals ever. The worrying figures come as Prime Minister Boris Johnson holds a press conference this evening alongside the government's scientific experts. Experts have previously warned that the reason the daily figure could be a record is because it is not clear how many people were actually infected during the height of the first wave due to a lack of community testing at the time. Earlier today, another 52 COVID-19 deaths were reported in UK hospitals, almost double the number of last Wednesday. Of these, 43 fatalities were reported in England, while there were 7 coronavirus-linked deaths in Scotland, 1 in Wales and 1 in Northern Ireland. Patients who died in England were aged between 43 and 98, and all but one, aged 72, had known underlying health conditions. Scotland recorded its deadliest day in 3 months. Nicola Sturgeon said the deaths of people who first tested positive for the virus in the previous 28 days are a very sharp reminder of the danger of COVID-19. The latest fatalities increased the overall death toll under that measure to 2,519. Speaking at the coronavirus briefing, the First Minister said, "That figure of 7 deaths is the highest I have had to report at one of these briefings since June 17. It is therefore a very sharp reminder that COVID is an extremely dangerous virus, as well as a highly infectious one." She said Scotland has recorded 640 new coronavirus cases in the past 24 hours, representing 10.3% of newly tested individuals, down from 11.5% on Tuesday. A total of 29,244 people have now tested positive in Scotland, up from 28,604 the previous day. There are 137 people in hospital confirmed to have the virus, up 14 in 24 hours. Of these patients, 14 are in intensive care, down 2 from the revised figure of 16 for the previous day. There have been a further 388 cases of COVID-19 in Wales, bringing the total number of confirmed cases in the country to 23,985. Public Health Wales said 1 further death had been reported, with the total number of deaths since the beginning of the pandemic increasing to 1,616. There have been 424 new cases of COVID-19 confirmed in Northern Ireland in the last 24-hour reporting period, the Department of Health has announced. A further coronavirus-linked death has been reported to the department. although it did not occur within the last day. The death toll recorded by the department now stands at 579. Elsewhere, a super-spreading event has been blamed for the deaths of 8 patients with coronavirus at one hospital. The people have all lost their lives at the Royal Glamorgan Hospital in Lantricent. 6 more people are currently in intensive care. The recent outbreak has seen 82 people infected at the Lantricent Hospital and has led to the Health Board has deciding to cut services and put measures in place to contain the spread of the virus. Things have escalated quickly over the weekend at the South Wales Hospital. The current outbreak is likely to have been caused by a super-spreading event, said the CWM Tafu University Health Board Executive Director of Public Health Kelechi Noem. He said, "It is very difficult to give 100% assurance that we first of all have a perfect understanding of how this has come about and that whatever interventions we put in place will work." Close quote. The influx of coronavirus patients has led the Royal Glamorgan Hospital to take drastic measures. As of today, patients who would usually be taken to A&E at the hospital in an emergency will also be sent elsewhere as part of the plan.